This is an extract from the Leader Coronavirus Daily podcast by the Evening Standard and hosted by me, David Marsland. To hear the whole thing, search for it on your podcast provider. There have been warnings for weeks. Operators of care homes made urgent appeals for help, like PPE for their staff, as coronavirus began its spread through some of the country's most vulnerable. Now we know the cost: 12,000 care home deaths since this crisis began. The figures are from the Office for National Statistics, who say they're continuing to look into it. A higher figure could yet be announced. Our Deputy Political Editor, Nicholas Cecil's with me now. Nicholas, what sort of picture do these figures paint about COVID-19 in our care home system?
Well, these figures today are slightly different because they show not only the number of deaths in care homes, but the number of residents of care homes who are dying, which is slightly different. Previously, we've had figures for care homes, but today's are really quite shocking because they show that if you look at elderly care home residents, more than 12,000 have died since the start of this outbreak in Britain. Just over 9,000 of those have passed away in care homes, but then a further 3,400 have died in hospitals. And the figure is actually likely to be even higher because there are lots of people, thousands of people dying beyond what you would expect at this time of year. Experts look at excess deaths, and these are 50,000 higher for the time of the epidemic compared to the same period on average over the previous 5 years. Now, not all these deaths are from coronavirus, but there are thousands which are unexplained. So the real death toll from coronavirus is almost certainly higher. And if you looked at indirect deaths as well, this includes people dying because they haven't been able to access hospital care. There are probably thousands of those cases as well.
And I think that figure, 12,000, apparently is around about a quarter of all deaths. I mean, is there anything that can be done, or what are people calling for to be done to help care homes and the staff and the patients in them?
Well, certainly the government has been accused of several failures over its care homes policy during the epidemic. Patients were being discharged from hospital into care homes without being tested. There have been shortages of personal protective equipment for care home staff. And some staff have also been working in several care homes, which risks the infection spreading from care home to care home. Now, the government is taking action on all these issues, but Labour and many people in the care sector believe this action is far too late. Well, one example is Sir Keir Starmer highlighted in recent days that the government advice, as late as March the 12th, was saying that it is very unlikely that care home residents will get infected with COVID. Now, at the time, that was probably the case because the level of the number of cases was very low. But reading that advice, people could have been misled over the real dangers to people in care homes.
There have been other figures released. We now know that the rate of coronavirus infections in London is down to just 24 a day. That must be really encouraging for the city.
Yes, well, that's the number of new cases, according to one study. So we don't know this for sure, but academics at Cambridge University, using data from Public Health England, have modelled scenarios in London and around the country. And for London, it could be as few as 24 new cases a day. One thing they look at is what they call R, which is the rate of infection. This is how many cases, if one person is infected, how many other people he or she will infect. And in London, that figure is believed to be about 0.4. Now, if you compare that to the highest region in the country, Yorkshire and the North East, that has a rate of 0.8. So the disease seems to be under far greater control in London. And this is leading to pressure from Tory MPs in particular to start easing the lockdown in the capital soon.
But if you do that, then you kind of have this piecemeal almost approach to regions being unlocked while some stay in lockdown, and that must lead to an incredible amount of complications.
Well, certainly the government haven't ruled out a regional approach to easing the lockdown, and that is in effect what is already happening in Scotland and in Wales. Certainly in their roadmap out of lockdown, they highlighted that it might not make sense to have the same policies for example, Cornwall and Newcastle if the disease was at very different stages there. So it's certainly something that ministers will consider, but it immediately throws up lots of problems. For example, messaging. How do you get tailored messages out to different parts of the country? Obviously, the stay-at-home message was very, very clear. Stay alert is nationwide. If you're having to tell Cornwall to do one thing, London to do something different, and then the Midlands something completely different as well, then it gets very complicated. And also, if you look at London, the population in London, in and out of London, is very, very mobile. So while you could have specific messages for London, people from outside London, other parts of the southeast or beyond could easily be bringing the disease back into the capital.
Search for the Leader Coronavirus Daily on any podcast provider to hear more from the podcast.